I'd like to talk to you about encouraging seniors to accept help. And as family doctors, we run into this all the time. They are frugal, they don't want to spend any money, and we don't blame them. They're stubborn, they don't want to accept help except from their kids. They don't want change, and we're all going to be like them someday, and I'm already one of them. But when they're getting into trouble, when they're showing up in emerge, getting sick more, injured, you start to have the chat with them and their caregiver. So I sit them down and I say, what do you want to do? And then I shut up, I stop talking, I let them tell me what their goals are. And then how do we reach those goals? And most of them want to die in their house and leave their money to their kids. So we say, how do we do that? Because most people are in denial. They think they're just going to live forever and then not wake up some morning. And as doctors, we know that doesn't happen, unfortunately. And so they have to plan for their decline. So the first thing I try to do is a very low sort of risk type of engagement with them. And I'll say, let's start with a home care assessment. And that's all I want from them. I don't talk about nursing homes or anything like that. Let's just get a nurse to come out from home care. It's free. You've paid your taxes for this. They can help you make a safe environment. They can help plan for nursing homes, plan to keep you in your home as long as you want to. So if you can get them to buy into that, that's a huge step forward because they're in the system then, and then they'll move along as they need more help. If they push back, I just back off again, and every time they come in, I just gently bring that up. And with some seniors, it's taken me 5 years to talk them into a home care assessment, but I'm always there. I'm always talking to the kids as well that are looking after them. And then I get out my trusty iPhone here, which can give me numbers and calculations, and I'll say to them, what's it going to cost to look after you as you need more and more help? Because they think the government's going to look after them for free, which unfortunately doesn't happen. Home care is good, but it's only a couple hours a day, and once you start getting dementia and wandering, or if you need to go to the bathroom at 3 in the morning, then you need round-the-clock care. So I tell them how much that's going to cost, and that sticker shock blows them away because it's like $170,000 a year. So then we start looking at what does a retirement home cost, and that's $5,000 a month or $60,000 a year. So huge numbers that the vast majority of Canadians have no idea and don't want to know until it's too late. Nursing homes are very reasonable, subsidized by us taxpayers, and they're about $2,000 a month. And that's all inclusive, so that's pretty good. But when something is that cheap, there's going to be a huge lineup for it. I always say to patients, it's like going to a nice restaurant and it was free, you would have a huge lineup out the door. So it takes 2 years to go to a nursing home. And if you go to the hospital with an acute problem like a broken hip or a stroke or a heart attack, the hospital's going to push you out in 3 days. They're not going to let you sit in the hospital for 2 years waiting for a nursing home. There's 1,000 people waiting for each of those hospital beds, and it's getting worse and worse every day as us baby boomers start to fall apart. And we're going to live forever because we don't smoke, but we're fat and we're wearing down our joints. So that's coming at us, and we have to plan for that. So you really need to talk to your seniors and plan for this because they have no idea what's waiting for them. So we as doctors, it's our job to enlighten them and teach them and show them, you've got to plan ahead. You can't just wait and let the government look after you.